Welcome back, everybody. Today's deep dive, well, it's all about medical cannabis in hospitals. We're going to be exploring a 2020 research study from palliative and supportive care. And you might be surprised by what we find. You know, when you think about cannabis in hospitals, you might assume that it's a no-go, but what if there's a way to make it work safely and effectively?
It is a common assumption, but this study really does challenge that notion in some really interesting ways.
Right. Like so many patients rely on medical cannabis to manage chronic conditions like pain, spasticity, nausea.
Yeah.
But obviously smoking isn't an option in the hospital. And even traditional inhalers can be inconsistent when it comes to dosage.
Yeah. And that inconsistency poses a huge challenge, for both patients and doctors. Imagine you're a patient, you rely on medical cannabis for pain relief, and suddenly you're hospitalized and you're cut off from that treatment. It disrupts your care plan. It could even lead to an increased need for opioids. It's a tough situation for everybody involved.
It really highlights a need for some alternative delivery methods. And that's where this study comes in. It introduces us to the SyqeAir inhaler, which is a novel metered dose inhaler specifically designed.
Think of it as like a high-tech way
to ensure that patients are receiving a consistent and reliable dose of cannabis medications.
Now you've got my attention. So how does this inhaler actually work? Does it use cannabis oil or?
Actually, it uses the cannabis flower itself, but in a very controlled way. The SyqeAir inhaler has these preloaded cartridges that contain a specific amount of cannabis flower, and that ensures that each dose is uniform and minimizes the variability that we see with other methods. So it takes the guesswork out of dosing.
Exactly. This makes it much easier for doctors to manage treatment and monitor its effects.
Fascinating. So tell me about the study itself. Who were the participants and what were the researchers hoping to learn?
So this was a pilot study conducted at Rambam Healthcare Campus in Israel. It involved 21 hospitalized patients who were already using medical cannabis. They were experiencing a range of conditions, from cancer-related pain and nausea to neuropathic pain, Crohn's disease, and even multiple sclerosis with spasticity.
Wow, so a really diverse group with a lot of different needs. What was the study design?
It was an open-label study, meaning everyone knew they were receiving cannabis, the researchers,
Yeah.
focused on feasibility. So could this device be used effectively in a hospital setting, along with patient satisfaction and overall safety?
Okay, that makes sense. So what did they find? Did the SyqeAir inhaler live up to its promise?
The results were actually quite remarkable. First and foremost, patients reported a significant decrease in pain within 30 to 60 minutes of using the inhaler. The study even includes a graph that shows each patient's pain level dropping noticeably after treatment.
Wow, that's a pretty compelling visual. Pain relief is huge. But what about the other symptoms? Did the inhaler help with nausea and spasticity as well?
Yes, the study found that the inhaler effectively reduced both nausea and spasticity in the patients experiencing those symptoms.
Fantastic. But even the best technology is useless if people don't like using it. What did patients and medical staff think of the SyqeAir inhaler?
That's another win for this study. Both patients and staff reported high levels of satisfaction with the device. They found it easy to use, effective, and a good fit for the hospital environment.
So far, so good.
Yeah.
But let's talk safety. That's got to be the top priority,
Okay.
especially in a hospital setting. Were there any adverse effects?
Well, that's one of the most reassuring aspects of this study. There were no severe adverse events reported. Only 3 patients experienced mild temporary coughing, which is pretty remarkable considering we're talking about delivering medication via inhalation.
That is impressive.
Yeah.
So to recap, this study suggests that the SyqeAir inhaler can be used to safely and effectively administer medical cannabis in a hospital setting. And it was well received by both patients and staff. This feels like a potential game changer.
It certainly challenges our assumptions about cannabis in hospitals. It seems that with the right technology, we can bridge the gap between patient needs and medical practice in ways we might not have thought possible before.
Absolutely. I'm curious, what were some of the other key takeaways from this study? What stood out to you as particularly important or surprising?
Well beyond just demonstrating the feasibility and safety of this specific device, the study also highlighted the importance of consistent metered dosing.
How so?
Well, think about traditional methods of cannabis use. The dosage can be very difficult to control, leading to inconsistencies in effects and making it challenging to study the therapeutic benefits accurately. The SyqeAir inhaler, on the other hand, allows for much more consistent delivery, which is crucial for both patient care and scientific research.
It seems like that level of control could open up a lot of possibilities, both for treating patients and for conducting further research in this field.
Absolutely. And there's another fascinating aspect of this study that I want to touch on. The researchers found that using the SyqeAir inhaler could potentially lead to a reduction in overall cannabis consumption.
Wait, really? I would have assumed that having cannabis readily available in a hospital setting would lead to more usage, not less.
It seems counterintuitive, right? But remember, the key here is that metered dose. With traditional methods, like smoking or using less precise inhalers, it's easy to overconsume. The SyqeAir inhaler delivers a specific, consistent amount, which could help patients avoid overdoing it and potentially reduce their overall intake.
That's an intriguing finding. I wonder what implications that could have for healthcare costs and patient well-being in the long run.
It's definitely an area worth further exploration, and this study gives us a lot to think about. It challenges our preconceived notions about cannabis in hospitals. It highlights the importance of controlled dosing, and it opens up a whole world of possibilities for the future of medical cannabis research and treatment.
I'm already eager to dive deeper into this topic. Before we do, I think it's time for a quick break. We'll be right back with more insights from this fascinating study.
You know, this study really does open up a lot of questions. For example, it focuses on using a specific type of cannabis, a strain called Bedrocan.
Oh, why that particular strain?
Well, it's a pharmaceutical-grade cannabis flower that's known for its consistency. It originates from the Netherlands, and it's carefully cultivated to ensure uniform quality and composition. This level of control is essential for research, especially when studying the effects of specific doses.
So it's not just about any cannabis. It's about using a standardized product that researchers can rely on. That makes sense.
Exactly. And it highlights the importance of considering the source and quality of cannabis, particularly in a medical context.
Right. And this study wasn't just about making cannabis available in hospitals. It was about integrating it into a formalized treatment plan.
Precisely. And that's where the metered dosing aspect of the SyqeAir inhaler becomes crucial.
Can you elaborate on that?
Sure. In this study, each puff from the inhaler delivered 500 micrograms of THC. This level of control allows doctors to adjust the dosage based on individual patient needs and monitor their responses closely.
It's like the difference between taking a prescribed dose of any other medication versus just estimating a dosage yourself.
Exactly. It brings medical cannabis into the realm of conventional medicine, where dosage can be tailored and adjusted for optimal therapeutic effect.
This study was a pilot study, wasn't it? What makes a pilot study different from a full-blown clinical trial?
A pilot study is essentially a smaller-scale preliminary study. It's designed to test the feasibility and safety of a new treatment or intervention before investing in a larger and more expensive clinical trial. Think of it as a proof of concept.
This is like dipping your toes in the water before taking the full plunge.
The perfect analogy. And in this case, the pilot study provided very encouraging results, suggesting the SyqeAir inhaler is safe, effective, and well-received by both patients and staff.
So what's next? Where do we go from here?
The logical next step would be to conduct larger-scale clinical trials to confirm these initial findings and gather more data on the long-term effects and benefits of using the SyqeAir inhaler in a hospital setting.
This feels like the very beginning of something significant. It's exciting to think about where this research might lead and what it could mean for patients in the future.
I agree. This study focused on a specific set of conditions: chronic pain, nausea, and spasticity.
Right.
Can you talk a bit about why those conditions in particular might benefit from medical cannabis?
Sure. Chronic pain, for example, is a huge problem. And traditional pain medications, like opioids, often come with unwanted side effects and a risk of addiction.
That's a crucial point. Many patients are seeking alternatives to conventional pain management, and cannabis has shown promise in this area.
Right. There's growing evidence that certain compounds in cannabis, like THC and CBD, can help reduce pain by interacting with the body's endocannabinoid system. That's a complex system that plays a role in regulating many bodily functions, including pain perception.
And not just pain perception, but also mood, sleep, immune response, and many other important functions. It's really a fascinating system.
It is. So by targeting the endocannabinoid system, cannabis can potentially offer a more natural and holistic approach to pain management. What about nausea? How does cannabis help with that?
Nausea is often the debilitating side effect of
Yeah.
chemotherapy and other medical treatments. And certain cannabinoids, particularly THC, have antiemetic properties. They can actually help reduce nausea and vomiting.
So for patients struggling with severe nausea, cannabis could offer much-needed relief.
Exactly. And then there's spasticity. This is a condition that causes muscles to become stiff and contracted, often associated with conditions like multiple sclerosis.
And cannabis can help relax those muscles.
Yes, there's evidence suggesting certain cannabinoids can reduce muscle spasticity
Yeah.
and improve mobility. It's remarkable how versatile cannabis is as a potential therapeutic agent. This one plant have potential to address so many different conditions.
It makes you wonder what other applications we might discover in the future. Are there any areas of research that you're particularly excited about?
There's a lot of promising research happening right now. For example, there's growing interest in the potential of cannabis to treat conditions like epilepsy, anxiety, and even certain types of cancer.
It's almost overwhelming to think about the possibilities.
Ah.
It seems like we're just scratching the surface of what we can learn about medical cannabis.
Absolutely. And it's important to emphasize that this isn't just about the science and technology. It's about people's lives. For many patients, medical cannabis offers a much-needed alternative to traditional medications with the potential to significantly improve their quality of life.
It's a good reminder that behind all the research and data, there are real people who are benefiting from this plant and the advancements being made in its use. It would have been fascinating to hear some of the individual experiences of the patients in this study.
I agree. Unfortunately, the study itself focused on the overall outcomes and statistical data, not on individual narratives, but even without those personal stories, the findings speak for themselves. The fact that these patients experienced such positive results in a hospital setting is significant.
It speaks to the potential of this approach and the need for continued research in this area.
Absolutely. This study has given us a lot to consider, but it's just one piece of the puzzle. There's still so much more to learn about cannabis and its potential applications in medicine.
This has been an incredibly informative deep dive. I feel like we've covered a lot of ground from the specifics of the SyqeAir inhaler and the study's findings to the broader implications for medical cannabis research and treatment.
We've explored the potential benefits of medical cannabis. For a range of conditions, we delved into the science behind how it works, and we discussed the importance of controlled dosing and further research.
I'm curious, is there anything else about this study that stands out to you? Any final thoughts you'd like to share before we wrap up?
One thing that really struck me about this study is its focus on integration.
Integration.
Yeah. It's not just about adding cannabis to the mix of available treatments. It's about integrating it thoughtfully and responsibly into existing healthcare systems. This study demonstrates that it's possible to do so safely and effectively.
That's a great point. It's about finding ways to make medical cannabis a viable option for patients who could benefit from it while ensuring its use is well regulated and evidence-based.
Exactly. And that requires open-mindedness, collaboration between researchers and healthcare providers, and a commitment to putting patient well-being first.
Well said. This deep dive has certainly given me a lot to think about. The future of medical cannabis seems full of possibilities, and it's exciting to imagine what discoveries and advancements are yet to come.
It really does feel like we're at a turning point in how we view and utilize medical cannabis.
Yeah, it feels like we're moving beyond the stigma and the outdated assumptions to a place where we can explore its potential in a safe, controlled, and evidence-based way.
Yeah, definitely. And this study, with its focus on metered dosing and the SyqeAir inhaler, raises interesting questions about how we approach medication in general.
Oh, so?
Well, this technology could potentially be adapted for other medications beyond just cannabis.
What do you mean?
Imagine a world where inhalers are used to deliver a wider range of medications, pain relievers, antibiotics, maybe even chemotherapy drugs. It could make treatments more effective, reduce side effects, and even improve patient compliance.
That's a fascinating thought. We often associate inhalers with respiratory conditions, but this study suggests they could have much broader applications.
Precisely. It's about finding innovative ways to deliver medication effectively and efficiently, and the SyqeAir inhaler could be a model for future developments in this area.
It's amazing to think that a study focused on medical cannabis could spark such a paradigm shift in healthcare.
It speaks to the power of curiosity and the importance of challenging conventional thinking. Sometimes the most unexpected discoveries lead to the greatest advancements.
This deep dive has certainly been an eye-opener for me. I feel like I've gained a whole new understanding of medical cannabis and its potential role in modern medicine.
I'm glad to hear that. And remember, this is just one study, one piece of a much larger puzzle. There's still so much we don't know about cannabis and its therapeutic applications.
But it's clear that the research is gaining momentum, and the possibilities seem endless.
Absolutely. And it's not just about the science. It's about the human impact. Medical cannabis has the potential to improve the lives of countless individuals who are struggling with chronic pain, debilitating conditions, and the side effects of conventional treatments.
Yeah, it's a good reminder that behind every study, every data point, there are real people whose lives are being touched by these advancements.
Well said. This is a field that's ripe with potential, both for scientific discovery and for making a real difference in people's lives.
This deep dive has given us a glimpse of what's possible, and it leaves me feeling optimistic about the future of medical cannabis and its role in shaping the future of healthcare.
I share your optimism. This is an exciting time to be following this field, and I'm eager to see what discoveries and innovations lie ahead.
Me too. And to all our listeners out there, I encourage you to stay curious, keep exploring, and never underestimate the power of challenging conventional thinking. Sometimes the most groundbreaking discoveries come from the most unexpected places.